Okay, thank you very much, Dr. Ko, for sharing with us the administrator's role in the Cbas setting. I would like to mention also Cbas program directors, depends on each center setting. You might have the role behind the program directors, but we need to go back to the basic duty. This is mentioned on the Title 22, California Code Regulation, and the 55005, the section, it said the program director's duties are developing the programs based on your participant needs. You need to implementing and coordinating the program. Then you evaluate and see if there's any change need, making the necessary of the program adjustment. Then you supervise your employee. But based on my experience, it seems not just easy. The program director role is just like you mentioned right there. In the real life, in real practice, as program at the Cbas Center, providing a person-centered care program director role will be more complicated than you expected. I believe the Dr. Ko, she may agree with my personal point of view. And I just summarized some of the role we could mention right here. I would say the first one I would like to mention about a monitor, because what's the role monitor? You supervise the program director, you supervise your program. You monitor your participants' physical, their emotion and cognitive change. And even though you also need to monitor your staff, what are they doing? I remember when I attend to RCFE administrators training, one of the speaker, he's a hands-on administrator. He wants to see, he do everything, he supervise everything. So I think the program director, you not just overall supervise your program, you need to see the whole environment. Everything is in favorable condition for you to run the program. So you need to foresee a lot of things which is not mentioned here in the Title 22. Also now the role is coaching. What's I mean? That's you have to, when you have to update information, you need to pass to your staff, okay? Right now you have the information from the department agent, from the Department of Public Health. You have different guidelines. You updated COVID-19's information day by day. For example, what kind of in-service you have to provide, and you need to provide in-service to all your staff, including your caregivers, okay, or family members. Another role is communicator. I would say this is one of the most important. You need to communicate clearly and effectively to your care team member. Okay, that's involved. You make the phone call, you using the internet, even we using right now the Zoom classroom. You need to pass all the information to your staff. Okay, and others telehealth tool that might keep everyone updated. That's very important. You go to market, you Google it, you'll see every day they come out, a lot of information is coming in. And I want you to be aware of all this information or any like software that can help you to fulfill these needs. And another role I would like to mention is the navigator. What's that mean? You obtain you needed information or service for your participant or for your care team. For instance, for example, you need a help your activity coordinator, you find out a Zoom service, you enroll it, register it, you teach your coordinator, activity coordinator, to how to perform group activity. It has happened in my center, and we have to do this kind of the navigators, the obtain the information. Or you need to do the research about what? The beginning of the pandemics, the COVID-19, you need to find out where to find to PPE, which is a personal protective equipment. You need to know right now, maybe you need to know where to find the COVID-19 testing centers for someone who might need to test if they are, what about a result. But I think one of another important role is just like a leader. As our topics mentioned, this is leadership. You need to be a good leader. Remember, lead a team, you need a skill. Okay, you need to be effectively, and you need to face all the kind of challenges that we have right now. And since it's unprecedented situation, we are facing the pandemics right now for COVID-19. I think a lot of people doesn't want to see that. So interestingly, this is not all in your program direct handbooks, okay? And I still remember, I was remind me every day you're going to see new challenge, and I still learning every day from the something I learned from the different from the day one when I was the program director. Okay, now I'm going to tell you a story that's we might like to exchange our own experience. Okay, here's the climax. Okay, as the program director in this year, especially in the Cbas center or especially in the home healthcare providers industries. Okay, remember this year in March 16 for this year, when the California governor Newsom issued stay-at-home executive order in response to COVID-19. Okay, this is a public health emergency. And then no one think about that before. All of a sudden, all the centers had to shut down their door to the public, and there's no more in-center services. And remember, that's happened on March 16. What about after that? In April 13, we are talking about 4 weeks after when the governor Newsom issued the letter. Okay, after that, April 13th, California Department agent and the Department of Healthcare Services, they announced the policy guidelines for us, for Cbas Center, to follow the temporary alternative services, which is TAS. For someone who is not familiar with the TAS, just that you know, it's a temporary alternative service, which is TAS. Okay, and then my question start here. Okay, in these 4 weeks, what have you done to assist your participant to fulfill their needs? Okay, then how will you coordinate your team member at home, because someone work at home? There's not allowed we to go to the center to provide a service. And this situation, how can you continue providing your service as the basics information? Remember, 4 weeks, nothing. We don't have any response from the department agent. We don't have any response. Every center grab or just follow their heart, like Dr. Cole mentioned. You need to do something because someone is outside, they need your help. Okay, as you, the healthcare provider, you need to fulfill and based on the best interest your need of your participant. We saw the different kind of response, and we saw also the very vulnerable participants suffer from different consequences based on the decision of the program directors in each center or even the shareholders. Okay, and for most of the Cbas provider, I can tell the test service start from April 13th, or some start date when they have the plan of operation approved by department agents. But remember of that, some of the provider, they start at the moment when the California governor Newsom proclaimed stay-at-home order. And what do they think at that moment? They think about the participants' need, just like the information or the example Dr. Cole, she mentioned. The first of all, they think they feel responsible. They feel they have a human heart right there. They think about the participant needs. Maybe they have a food shortage, lack of transportation, lack of medical services. So at that moment, you see the quality of the service between each center. Okay, I would like to define the person-centered care as care is always respect the right, needs, opinion of the person or your participant. That's very simple, concise. I'll repeat that one. Care always respect the right, needs, and opinion of participant or your person. Okay, let's go from there. We'd like to start. How about the program, your role, your responsibility as a program director in the Cbas Center? Okay, as a requirement, we need to follow all the regulation, and we need to provide an individual plan of care based on the participant's needs. And it could be involved in different disciplines: nursing, social worker, OT, PT, activity. In addition, you might have a LCSW, dietitian, speech therapist, even the transportation. Okay, for in-center service, this you say that it's very easy to arrange and to implement. Okay, but have anyone think about telehealth before the COVID-19 impact our life? Have you ever think about that? Do you think about that? last year, when you were at Christmas, no one think about it. Okay, but suddenly it changed everything. It changed your role. It changed the way how you run the business. Okay, it changed how you rate to take care of your participants. Okay, as a program director, about to fulfill regulation requirement for our participants' need, my question always go back to the original. Okay, how to develop the programs based on their needs, how to implement, how to coordinate, how to evaluate when they change their need, and then how you supervise everything you just, the basics you need to go back to the original. Okay, the implementation of the IPC, which is individual plan of care, require research of different resources, especially during the test period. You need the training, you need to arrange, you need what's the most important? You need a positive attitude toward a challenge. You positive attitude, I think that's very important. Someone just get something wrong and they just sit back right there and waiting for someone to give them the order to follow. But as a program director, you cannot do that. As care provider, you can do that. Think about if that's your dad, is that your parents? Are you going to just stay there for what's the department agent tell you? No, you do something, right? Okay, different Cbas center have different setting to fulfill their needs, their requirement. Okay, some have the on-site staff, some have the staff just working at home, some have health and health, which is a hybrid, a combination of part of staff working at home and the part of staff working at center. Okay, but for the telehealth model that we are talking about right now, we are facing a challenge of communication. Why? Because when you at center, everyone sits just right there. You can call for a meeting and then you start your meeting. But right now, someone is at home, someone is at center, but you need to create an environment of communication and how to integrate your whole team, how to respond immediately for any change by providing your service. What would you do? Maybe we are not used to involve the family member or caregiver as part of our care team, but I would like to encourage you to do so because they could facilitate your service. They can give you a lot of feedbacks, tons of feedbacks, informations about your participant. They give you the way to improve your quality of life. That's what we are facing right now. Every day we receive the text, we receive the from the maybe the WeChat, and they just tell you what do they need, what kind of service you are providing, and they don't like it. They want something different. Okay, because we are talking about the person's center, and we need to think about that one. Okay, given for example, when you have those kind of service, when you driver, you have a delivery staff, just go to your participant's house, then they find out the family member, tell them, okay, the participant is hospitalized last night. Okay, so what would you do? What's that trigger to you? What kind of service you have to follow? Or they tell you, oh, unfortunately, my consumer, my participant got a positive result from COVID-19 testing. You need to follow the guideline. You need to contact, you need to report incident report. You need to do something that's everything. It's not, you won't see before the COVID-19. It's totally different, the environment. Okay, so we have to follow our guideline from department agent. Okay, do not just forget the read all the centers data that's from department agent, and it comes a lot of information. Okay, maybe you can have some kind of the doubt that you don't know and you don't find anywhere, that just contact your CDA, department agent's advisor. I think they'll be happy to help you or just guide you to another department to fulfill or to resolve your questions. Okay, that's pretty much what I trying to share, but based on the way how we practice, I want to see, and maybe to wrap it up, for the care implementation or documentation. Remember, there's a guideline, there's a circle always. When we do the participant assessment, we create the IPC, individual plan of care, based on the person-centered needs. Then we create the service, then we need to implement all those services. What do you do after you provide the service? You document. Where? To your progress note. Use a different tool. You can use any commercial documentation software. I don't like to mention any. I don't want to do any publish for that. But for my experience, I use the Google